So welcome, everybody. Before we do get started, I do want to let you know that we are recording today's session. My name is Mary. I'm one of your hosts from AARP for today's webinar. I am a lead AARP New Hampshire volunteer. With me tonight is AARP New Hampshire staff, Ashley Davis, and Ashley will be monitoring the chat. We do want to hear from you this evening, so if you would like to ask a question or make a comment, please use the chat box, which can be accessed by clicking the chat button at the bottom of your screen. At AARP New Hampshire, we are focused on the health, the financial security, and the social connections that are critical to the well-being of the 50+ in the Granite State. We carry out our work through targeted advocacy at the state and at the federal level, with compelling engagements for the 50+ community statewide. And we serve as a trusted resource for information for our members and the public. Our presentation this evening is the first in a series we are calling the Caregivers Compass. AARP has many resources for caregivers, and we work hard to advocate for caregivers and provide them the support whenever we can. Tonight, we are working with the state of New Hampshire to ensure you are aware of everything local that is available to help you as well. Our presenters tonight include Wendy Altman, who is the Bureau Chief at New Hampshire Department of Health and Human Services. Wendy has worked for the Department of Health and Human Services since 1998. For the past 27 years, her work is focused on administering adult and aging programs and policies such as the Aging and Disability Resource Centers, Older Americans Act supports and services, adult protective services to prevent abuse, neglect, and exploitation for our vulnerable adults. She has a passion for advancing aging policy and programs and strengthening home and community-based services for all our payers and our populations. She also works to build capacity for an age-friendly community at the state and local level. Wendy is joined tonight by Kate Kaplan, who is the Aging and Disability Resource Center Administrator for the Bureau. Kate has more than 5 years of service with the Bureau, and she has a history of New Hampshire-focused support. I want to thank you both for supporting caregivers tonight. We are grateful for your time and your expertise this evening, and I will now hand it over to you, Wendy.
All right. Thank you. Thank you, Mary, and thank you for the introduction. I want to say good evening to everyone and thank AARP New Hampshire for inviting Kate and I to join in this webinar series and take part in engaging in discussion and questions while we present some of the information that we have for you all tonight. As Mary said, I'm Wendy Altman. I'm the Bureau Chief at the Bureau of Adult and Aging Services here in New Hampshire with the Department of Health and Human Services. And our Bureau is the state unit on aging, and we are responsible for administering Older Americans Act services, coordinating our state's Aging and Disability Resource Centers, and implementing our state plan on aging here in New Hampshire. So in New Hampshire, family caregivers are the heart of how we support older adults and adults with disabilities. And these caregivers are the invisible backbone of our long-term care system. These caregivers make it possible for thousands of older adults to remain in their home rather than institutions. And as the population grows older here in New Hampshire, by 2023, 1/3 of our state will be age 65 and older. And the need for support and caregivers has never been more urgent here in our state. And we're happy to be able to work on programs and policy and provide tools to support our caregivers here in New Hampshire. This provides a little overview of the landscape of what caregiving looks like here in New Hampshire and nationally. So, in New Hampshire, family caregivers are the foundation of our long term supports and services. They are often the reason an older adult can remain at home. And our roles at DHHS through our Bureau, the Bureau of Adult and Aging Services, as the state unit on aging, is to strengthen and not replace what families already do. Nationally, caregiving is valued at over $600 billion. That's billion with a B. And in New Hampshire, that's about 2.3 billion in unpaid care. We're recognizing that as our population ages and workforce pressures grow, supporting family caregivers is not optional. It's really essential here in our state. And AARP's Prepare to Care resources and tools give caregivers 5 simple strategies to help plan ahead. And here at DHHS, we've built a system that aligns directly with those strategies. And we want to be able to talk through what that looks like, because for every AARP tip, there's a New Hampshire resource that's ready to help. So AARP Caregivers Roadmap is the roadmap. And in New Hampshire, our job is to make sure that every step on that roadmap connects to a real local resource. So whether it's stress management, finances, or home safety, there's a program here that fits, or resources, information, and tools that we can make connections to. AARP has developed an excellent national tools under that Prepare to Care umbrella and provides that practical guide that walks families through planning, organizing, and communicating. And here in New Hampshire, our state system lines up directly with those same steps. So here's how some of that fits together. The Prepare to Care planning and reducing stress element. Through our New Hampshire Aging and Disability Resource Centers, caregivers can complete what's called a T-Care assessment, and that's a nationally validated tool that helps measure caregiver stress, identify supports, and creates an individualized care plan for family caregivers. And it mirrors AARP's first principle, which is preparing early and knowing your limits. Managing a loved one's finances can be connected to one of our programs that we administer, which is called our state health insurance program. As one example, this provides one-on-one Medicare counseling and helps families understand long-term care options. And we also fund legal assistance programs under our Older Americans Act funding that we get here in New Hampshire, which offers powers of attorney, guidance and help with guardianship, or just navigating financial exploitation or other questions caregivers may have. We also look at the discussing of end-of-life care. Our Bureau partners with the Alzheimer's Association and healthcare providers to normalize advanced care planning discussions. And our Alzheimer's and related disorders respite program offers short-term breaks for caregivers, which often gives family the time and space to plan those kinds of sensitive discussions that happen. Creating a safer home also aligns with our Choices for Independence waiver program, or our services that we fund under the Older Americans Act, which provides caregivers access to things such as home modifications, adaptive equipment, homemaking services, or help within the home to provide that respite care or additional support. And sometimes those small changes, like a ramp, a grab bar, make it possible for loved ones to age safely at home. Also, handling legal affairs and medical care management, things such as our program called Senior Medicare Patrol, help to educate families about preventing healthcare fraud, billing errors, and for ongoing daily management. New Hampshire offers family caregivers access to Trualta, which we will talk about in more detail, which is an online learning platform that offers uh, courses on medication management, dementia care, self care, stress reduction, and really fits around AARP's and Prepare to Care and provides that framework. And New Hampshire provides that entry point and the connections to some of those local tools and resources. So I'm going to move this and pass this over to Kate so she can talk a little bit more about our Aging and Disability Resource Centers and all of the tools and supports they offer.
Thanks, Wendy. You have control of the deck, right? I don't need to. Okay, good.
You can just tell me when to go.
All right. Thanks, everyone. Thank you for joining. This slide is just kind of an overview of what the Aging and Disability Resource Centers offer. So a lot of times the big question that everyone has is, where do I even start? Where do I go to get the information that I need? Or sometimes they don't even know what to ask. And this is where we say, call your local Aging and Disability Resource Center. So you may already know about these. They were previously called ServiceLink. We did do a name change. Same services, same information, but we shifted over to the federal terminology, which is the ADRCs, as you'll hear us call them. Each county has one. Some counties have two, depending on the size of the county. Hillsborough County has one in Manchester and Nashua. Grafton County has one, both in Littleton and Lebanon. So we cover all of the state, and we offer options counseling, which covers all of the needs of someone reaching out. So whether that be they need help with a Medicaid application or just navigating a system or asking questions about planning for the future with long-term care, Medicaid and Medicare help, as Wendy mentioned, with the Medicare programs, and respite grants and training, which is directly related to the family caregiver program that we're going to talk a little bit more about. Go ahead. Thanks. There it goes. So we contract with 7 different agencies in New Hampshire, and we have 12 locations. Well, 13 technically. The Plymouth location is open by appointment only. The other locations are all open Monday through Friday around 9 to 5. You can walk in, you can call, you can make an appointment. Whatever's the easiest way for you to get in touch with them, they're always available. I think that's good for this slide.
There's a little catch up there.
Yeah, it's a little delayed. Yeah. Okay. Okay. And so how do the ADRCs come into play here? This is the pathway to caregiver support. So we cover caregivers aged 18 or plus caring for their loved ones. So whether there's Alzheimer's or other related dementias, or just adults that are age 60 plus. We also are providing respite and grants for adults caring for children with disabilities, as well as grandparents or relatives age 55 or older that are raising their minor relatives. So we've seen a really big uptick in that population recently as well. So we can go over in the next couple slides, we'll go over kind of what that funding looks like and how we connect people to those funding streams and what's available under those. Okay, so if you contact the ADRC and you are identified as a caregiver and you're looking for respite or you're looking for help because you just started taking care of your mother or your grandchild, they're going to talk to you about different types of respite, whether that be in home, personal care, some homemaking, a companion just to come sit with your relative. There's adult day options available or short-term facility visits. And we also offer emergency impromptu respite. So this is, oh my gosh, I have something that I have important that I have to do, and I can't leave my loved one without care. So we're able to fund that quickly and get you the care that you need to make that happen without going through the full assessment process. We would do that on the back end.
I'm getting the hang of this.
I'm like pausing. Oh my God.
There we go.
Other funding with this grant is through supplemental funds. So this will cover things like chores, transportation, health-related supplies. A big one that we see is incontinence supplies. So we can help pay for those with the supplemental funds portion of the grant. Nutritional supplements. A lot of people use their supplemental funds to purchase Ensure that I think it's a high calorie, high protein shake. We can do some home repairs or mods to make the home safe or accessible. Assistive equipment. And then when it comes to the grandparent or relative caregiver caring for like a young, a minor, we can do summer camps. We can do school supplies, after school activities, clothing, sports, extracurricular. I've seen a lot of requests lately for help with music classes. So buying an instrument for the grandchild to be able to do music classes. So I think that's a really great use of the funds. So there are funding limits on each grant of $2,000. So that kind of gets split up between respite and supplemental, depending on the need of the caregiver. However, there is always the option to ask for more if it's needed. So if you need $2,200 for such extra school curricular activity, a lot of times we can make that happen. So it's always worth having the conversation with your caregiver specialist at the resource center.
So the next slide really gives a more in-depth look at TCARE, which is our evidence-based system. And I think Kate was going to talk a little bit about the outcomes, the positive outcomes that we've seen while we've been implementing the TCARE tool with family caregivers in the ADRCs. And she's just going to talk a little bit about what she's seen with our aging and disability resource centers and the caregiver counseling.
Yes, sorry about that.
That's okay.
So the TCARE plays a part from the beginning all the way through the process. So they use it to do an assessment of burden on the caregiver. At the beginning, they do a 6-month check-in, and they do it after a year. And then if they re-up the grant for the next year, they do it again. So it's really tracking every 6 months or so, kind of how is this caregiver grant and supplemental funds helping lessen the burden on the caregiver or create a better sense of self or make them feel better about what the caregiving that they're doing. So on the next slide, you'll see that from October 2024 through September 30th of 2025, all of the data points for burden that were measured were either lowered or remained stable in New Hampshire. So identity discrepancy, for example, it's the caregiver having a negative state of mind. So they're not feeling good about the state that they're in or what they're having to do or how they're handling their situation. And we lowered that feeling by giving them this grant or offering them these tools through this caregiver program. Same thing with relationship burden, stress burden, objective depression, 90% lowered, which was great. And then intention to place. So we 90% lowered of intention to place is really the goal. We want to keep people in their homes. So I think that's a really good data point to show that this program and TCARE are working well together. Trualta is our education platform. It helps caregivers build skills, confidence, find other like-minded individuals to talk to. It offers support groups. It offers live webinars. It offers private one-on-ones if you want to have those types of meetings with people available. There's a chat. You can just chat with other caregivers on Tralta, which I think is really cool, just to kind of vent and get other people's opinions on how they're doing things. So I think the data, it says more than 330 New Hampshire caregivers have enrolled since launch. So we promote it with the caregiver program, and it is free to all New Hampshire residents. So it's a really great platform. Some of the ADRCs also offer in-person support groups. So if you're in Merrimack County, they have a very big support group in Merrimack County that is very successful, and I highly recommend. So those are really nice as well. So this is kind of takes the place of those in-person support groups and offers the caregiver a lot of flexibility.
All right. So this really talks about how caregivers can take action, and we wanted to give, a little bit of information to kind of summarize the tools that are available to people, as well as the other things that they can explore. And Kate, I don't know if there was something more you may want to add in terms of a story or an example of a caregiver that you know of that's used it or provided feedback to us.
With Trualta or
Yeah.
with Take Care?
Yeah, what you're hearing from caregivers or from the ADRCs about the caregiving.
Yeah, I have not heard directly from a caregiver, but I did just recently speak with a caregiver specialist who recently spent more time in the platform and started learning about it. And that was the chat feature, which I said is really cool. Being able to kind of meet someone that's in your shoes and is living the same life experience as you, and just being able to have that relationship or find these people that understand what you're going through. She said that she had a few people that really found that helpful because they could just bounce ideas off them, or they can put, there's also a forum that you can put questions in if you're not sure, if you're looking for advice on any specific situation. So I think that the person-to-person connection that it's creating is going to be great, especially if we can start promoting that more now that we know about it.
Right. I think that it's important for caregivers to know that they're not alone, and to be able to have some of those peer supports available to them, especially during a time of high stress. And building. We want to be able to build and improve how we support family caregivers in New Hampshire. So we're always open to feedback or input as it relates to some of these tools and how we can strengthen them here in New Hampshire. But really, if you don't know where to start, as Kate said, calling the Aging and Disability Resource Center, previously known as Service Link, having access to the T-Care tool and the Trualta training, and just looking at some of the results that we've had with people who have used the T-Care assessment tool, I think speaks for itself in terms of how we've been able to help many family caregivers here in New Hampshire. We also wanted to provide some connections to other supports that can keep you connected to what's happening within our Bureau of Adult and Aging Services. We make connections to things that are happening each month. We have a link here to our newsletter, and we put it out at the beginning of the month, all throughout the year. So this year, this November is National Family Caregivers Month. So we have several things within our newsletter currently that was released last Friday to support family caregivers and point them to other supports and tools. Also, part of this is a link to our page, and we can put some of this in the chat if and share that also with AARP as a follow up. And we have a caregiver page dedicated to really just providing an overview and a little bit more detail around our family caregiver program and links to other resources that we've mentioned before related to Medicare counseling, connecting to somebody about Medicaid, uh, looking at some caregiver stories, supports and services for individuals who may be looking for home delivered meals, for example, or other supports that may help them. And there's also a searchable database of resources. So many people want to sort of navigate things on their own and see what there is. So our website also has a searchable database that people can look at for themselves. And then if they have any questions, there's always the number people can call, which is the Aging and Disability Resource Center phone number. We also have information related to adult protective services and how people can report abuse, neglect, and exploitation. And I often provide that information so that people know where to go and who to call if they have any concerns. Let's see. There. I also wanted to touch a little bit on our system of care for healthy aging. And what the system of care for healthy aging is really a component of looking ahead at New Hampshire and how we are envisioning modernizing our entire system for anybody who's aging. And we have little pins, we give them out. It says, aging, everybody's doing it. So it's really about messaging that there's never a wrong time to plan. There's never a wrong age to plan or be thinking about your future and how you want to age in your community. So in 2023, there was legislation or New Hampshire law that was passed that created the system of care for healthy aging, which aligns Medicaid long-term supports, Older Americans Act, and other community services under one coordinated vision. And as part of this, we have also joined the National Academy for State Health Policy Learning Collaborative. And AARP is a close partner with us within that learning collaborative. And we're one of only 13 states who were selected to be part of this work. And our goals over the next 18 months include expanding self-direction or other models that allow family members to be paid caregivers and how we strengthen that, increasing respite options and flexibility for both Older Americans Act services and state grants, updating our Do You Care campaign that we have here in New Hampshire in partnership with our Alliance for Healthy Aging and other close partners, which really helps caregivers to self-identify earlier, and integrating our caregiver priorities into the upcoming work that we have happening with what's called a multi-sector plan on aging, which is really the large, broad view of aging well in New Hampshire. And we're also going to be in the near future updating and revising our state plan to strengthen how it aligns with our federal regulations called the Raise Family Caregiver Act and the National Strategy for Family Caregivers, especially goal 1 and 3, 1 through 3, that really focus on awareness, engagement, and support. And ultimately, we want every caregiver in New Hampshire to be recognized and supported and included in the policy and practice that we are moving forward in New Hampshire. So, New Hampshire's system of care for healthy aging and what that means for caregivers is that we're building a statewide network that makes it easier for older adults and families to get the right help at the right time in the setting that they choose. And our focus really is to simplify access, have that one coordinated system where caregivers and older adults can find information, eligibility help, and services in one place. We hope to expand supports and have more home and community-based options so that families can age safely at home. And we want to build confidence and have those clear standards and better oversight and transparency so caregivers know what to expect from providers and those who may come into the home to help support caring for their loved ones. We also are focused on strengthening those partnerships that we have at the state with our provider agencies and our aging network, as well as some of those community partners that are working together for caregiver supports. And then, of course, we want to continuously recognize caregivers as essential partners in the health and aging system. And we closely partner with the Alliance for Healthy Aging and the work they do to bring together family caregivers, whether that's coffee and caregiving sessions or the work group that we have that focuses on just making improvements and keeping the progress going with some of the work that we're doing. And this really matters because these initiatives, as part of are also part of our New Hampshire DHHS roadmap, as well as our state plan on aging. So it drives the work and the focus that we have in helping older adults live with dignity, independence, and choice, while ensuring the caregivers that support them have the support they need to stay in the community. And now we want to be able to open it up to any questions, ideas, challenges. We want to hear from the folks who are taking part in this webinar and talk about any questions that you may have about the information we've shared, as well as discuss any ideas, things that are working, what supports you'd like to see next. And Kate and I will make sure that we take that back to our partners and our team. And I'll forward the slide here because we put our contact information on this last slide. So if people want to take a picture of it or write it down, they can do that as well.
Hi there, Wendy. Can you hear me?
Yep.
Wonderful. So I just had a question to bring to the table. Just wondering, thank you so much for your presentation. I feel like it was so comprehensive. And I'm wondering if you have any suggestions for people who need, one thing that AARP works on is livable communities. And sometimes that involves, modifications to a person's home. Are there any programs here in New Hampshire that support changes to folks' homes?
Yes. So certainly that's a fairly common question that our aging and disability resource centers get. Because our aging and disability resource centers really help all populations, all payers in terms of the information, referral, and guidance that they provide to individuals. They can connect people to local programs within the county or within towns and cities that help provide some of that support. They can provide connections to some of the agencies and companies that offer home modifications or adaptations or what we call environmental modifications that sometimes can help keep people safe, especially, for example, if they are caregiving for someone with Alzheimer's disease or related dementia, and they are wandering or need to be safe in the home. There are gadgets, gizmos, other equipment that we can help provide access to or give referrals to, and provide some of that support. And Kate, I don't know if you have anything more you want to add to that.
Yeah, I can add a little. Speaking of the gadgets and gizmos, we just authorized, like, we're doing some supplemental funds to pay for an air tag. Sounds simple, but the person was a wanderer, and so they have an air tag that kind of helps track them. So that was a really cool idea. And then we've done a couple kind of home modifications with the supplemental funds just to make the home either safer or accessible for the person. So I have authorized a ramp, and I have authorized I think it was like something grippy on the steps so that there wasn't a slip hazard as much. So if you're part of the caregiver grant, there are those options that we can help with within the funding limits, of course, but we can do a few things there.
And and sometimes people have the funding, or they don't realize that sometimes there are benefits or insurance that help pay for some of those safety things, in terms of medical equipment or grab bars or things like that, to help with modifying bathrooms, things like that. Through our Medicaid Choices for Independence waiver, if an individual is eligible for that program, there are services within that waiver program that help with home modifications and specialized medical equipment, both to help the caregiver and the individual who needs care, to make the home safe, to make doorways larger, modify bathrooms, and also to modify vehicles, and provide support that really both help the individual and the family caregiver for safety.
That is really incredibly helpful and so encouraging to hear that there's so many different ways and so much flexibility in the support that you guys are providing caregivers. At this time, we don't have any other questions in chat. So I'd like to thank everybody for joining. Especially thank you to Wendy and Kate for your presentation, for providing these resources on a day-to-day basis, and all the work that you do around the state to support caregivers. Finally, a thank you to our volunteer, Mary, for all of her hard work on this presentation as well, making sure that the Zoom was set up. If anyone has questions, you can always reach out to AARP New Hampshire, and we can make sure that you're connected with Wendy and Kate and their fantastic team or other resources around the state. So thank you all for joining us today. I hope that everyone has a peaceful evening, stays warm, and enjoys the holidays.
Thank you very much, Ashley. Thank you, Mary.
Thank you.
Thank you, Wendy. Thank you, Kate. And thank you, everybody, for joining us. I am going to, hold on a second.